This is the lecture for exercise throughout the lifespan. So this includes children, pregnancy, older adults. As a reminder, the benefits of exercise include improved cardiorespiratory fitness, flexibility, balance, muscular strength, improvements in quality of life, reduction in symptoms. If anybody has diseases, many diseases, the side effects and symptoms can be reduced with exercise, improvements in breathing, and maintain and slow the loss of muscle mass. So these are benefits for everyone who exercises, but they may be especially important for different stages of the lifespan. As a reminder, some of these populations are going to be special populations. For example, pregnancy and older adults. Some of these groups are at increased risk for cardiovascular event or stroke. There may be joint concerns, maybe concerns with hyperthermia. They may have barriers to exercise. Everybody has a barrier, but someone who's a member of a special population may have additional barriers. And we should be aware of exercise contraindications in general. So for example, chest pain, but also for special populations. So for example, with pregnancy, if there's bleeding. Reminder for FIT-VP for special populations. First, look at the medical history, including all medications. Look up the physiology of the medical condition. Look up the medications and their impact on physiology. So for example, does the medication have an impact on heart rate, blood pressure, muscles, lung? Does it increase somebody's risk for balance issues or vertigo? If somebody's taking more than one medication that has one of the side effects, so for example, if they're taking two medications that list vertigo as a side effect, they're more likely to have it happen than if they just have one medication that lists vertigo as a side effect. What are their barriers to exercise? How can we help them work around that? And what contraindications are there for exercise? Then we'll make an exercise plan. If they're deconditioned, we're going to need to start low and slow, so to lower intensity and at a slower rate of progression. Depending on the conditioning level of the individual, we may want to start with just 10-minute bouts and work up to the ACSM recommendations of 30 minutes per day of moderate activity. And it's important to remind the person that some exercise is always better than none, and that we're also working to reduce sedentary time. So it might be discouraging to somebody who used to be able to exercise for 30 minutes or even an hour, and now we're starting them off in 10-minute bouts, but we'll remind them that that's 10 minutes more than they did the previous day, that some exercise is always better than none, and it's on them to also reduce their sedentary time. If they're watching TV, the night commercial breaks, get up and walk around a little bit between episodes. If they're doing a Netflix binge, then maybe do some stretching, some flexibility. First population we'll start with is children and adolescents. And many of the exercise measurement methods, many of the testing protocols are designed for adults, and they're not scalable to children. We very rarely will do a VO2 max test on a child, for example. We won't do 1RM tests on a 6-year-old. Sweat rate in children is lower than adults. If you ever coach or have gone to a kid's soccer game, for example, or some other outdoor sport, baseball, you'll notice the kids don't really sweat a lot. They just get kind of red and flushed. So we can't use sweating to judge their exertion. We need to make sure that they're staying hydrated. The temperature when sweating starts is also higher than in adults. So again, we just really need to watch hydration with children. Cardiorespiratory fitness for children. Depending on the age, heart rate at rest could be as high as 100 to 110 beats per minute. Their heart rate max is also higher than adults. Children also recover faster from acute exercise. If you notice that, you're running around with the kid, and they're like, I need a break, and then they're like ready to go before you are. This also means that heart rate, oxygen consumption, and ventilation return to resting values quicker in children than adults. Their stroke volume is lower, though, which means their cardiac output is lower. That may be why their heart rate is higher, to help compensate for that lower stroke volume. I don't know for sure. Speculating at some point. Children and adolescents have a greater oxygen cost during exercise than adults. They're not as efficient. They're not quite many adults when we're talking about exercise. We just talk about these differences here. So their oxygen costs are also different than adults. As far as strength and flexibility goes, muscular strength increases with age. I think that's pretty intuitive. You know, a 6-year-old is not as strong as a 10-year-old, and a 10-year-old is not as strong as a 16-year-old, and so forth. And this is related to increases in body weight, height, fat-free mass, and muscle mass. Motor performance measures tend to improve with physical maturation. For example, jumping. This is an easy example to observe. If you tell a 4-year-old to jump as high as they can, what do? Do they crouch down and jump up? No, they kind of jump from where they are. They might crouch a little bit, but if they haven't had specific sports training to teach them to do that, their natural intuitiveness for jumping high is they're just gonna kind of flex their ankles and reach up. If I ask one of you to jump as high as you can, you're going to crouch down and jump, right? And that's not something you're telling yourself. You're not saying, all right, I'm going to crouch down really deep and this is going to change my joint angles, et cetera, et cetera. You just know that. So that leads to differences in motor performance for children versus adults. At young ages, girls tend to outperform boys in flexibility measurements and in some measures of balance. Some of that stays throughout the lifespan. In teenagers, the girls still are generally more flexible than the boys. It's not always easy to do with children heart rate, for example, to judge their intensity, even things like running pace or swimming pace. And they try and teach kids this to kind of a progression of learning, but it's still a difficult concept for them to understand. For example, my kids swim, and with one of them, the age group that this kid is in, they'll tell them what the pace is and what they're targeting for on the time, but the coach will walk the pool so the kids have a visual cue as to where the pace is. Whereas with the older kids, they can just say, this is your pace, and the kid knows what it is. So what we use instead with children is a child-friendly Omni scale, and we have Omni scales for specific activities. I need to update these. We have some newer ones that we use. So there are these scales, and it's like an RPE scale with 0, not tired at all, 10, very, very tired. So it doesn't talk about strenuous. It doesn't talk about working hard. It talks more about being tired. The kids can generally relate more to the feelings of tiredness associated with exercise than whether something is vigorous or strenuous or hard to do. It might just be hard because they don't know how to do it. And it has these pictures of what somebody looks like. So if you tell somebody like, oh, I want you to exercise at a 6, which is right here. So you're feeling a little bit tired, but not completely tired, but you feel tired like this. And they have scales, like I said, this is one for running. And they have ones that look like boys, ones that look like girls. They have new ones that are a little more neutral. And I should download one of those for an example. And then we have different activities. So I just showed you one for stairs, and here's another one with boys for stairs. So there's different activities again that corresponds to the child in the figure doing. Our exercise prescription for children and adolescents. More exercise, at least 60 minutes of moderate or vigorous activity daily. Vigorous activity is included on at least 3 days per week. Personally, Dr. M's input, this is probably what every adult needs as well. We probably all need 60 minutes of exercise, moderate exercise every day, health willing, of course, at least 3 days a week of some sort of vigorous or HIIT activity. But we know for adults, the benefits start at 150 minutes total per week, but up to double that, not to that, but even double that we know is beneficial. So I think ideally this would be good for adults as well, but it's not our official recommendation. It is for children though. Muscle and bone strengthening activity should be included within the 60 minutes on at least 3 days per week. Muscle and bone strengthening activities, a lot of times when we hear that as adults, we think of weight training. That's not necessarily what it has to be with kids. With kids, it can be body weight exercises, it could be jumping, it could be things of impact. That's going to give them bone strengthening activities. It doesn't have to be strength training when they're young. We want to incorporate activities, like I said, that have a lot of jumping, other impact activities. There are some guidelines and recommendations for resistance training and plyometric training for youth. In general, a muscle strengthening program should target large muscles and include 5 to 10 minutes warm up and end with a cool down. Talk a little more specifics about that in a minute. Right. So this resistance training exercise prescription for children and adolescents. The general prescription is 6 to 15 repetitions to fatigue, 1 to 3 sets on non-consecutive days. If it's a young athlete interested in power, 1 to 3 sets, 3 to 6 reps. And with children, especially with adolescents starting out, we really want to monitor proper form. We're more concerned about the form than with the sets and the reps with that. Always start with light weights, progress intensity gradually by 5 to 10%. That's what we do with adults. So make sure that the kids really have the correct form before increasing weight though. If a child consistently fails to perform resistance exercises safely, the child may not be emotionally mature enough to safely engage in resistance training. And consideration should be given to delay the onset of resistance training for that child. ACSM generally recommends that we wait until 8 years old before we start a resistance training program because we want them to have the maturity to be able to do proper form, to understand a little bit about cueing with their body and what feels right or not. And some kids, they may be older than 8 before they're ready for that. If a kid can't correct their form, and when you correct them, they can't correct their posture, and they can't lift correctly even with a light weight, then we may need to delay, try again another 6 months or so, see if they're ready then. Families should be encouraged to engage in active and fun activities together to establish lifelong physical activity habits. There's some research that trying to get a kid to become active is more effective for the long term if you can also get the rest of the family involved to be active as well. They do the activity together. Games so that children are not eliminated from play based on poor performance. A classic example of this is dodgeball. The slow kid gets out first. By slow, I just mean movement slow. They're not as quick on their feet. And then they sit on the sidelines, when in reality, that kid that has poor agility and has some poor physical performance probably needs exercise the most, but now they're sitting out and they're not getting that benefit of play and of exercise. That doesn't mean you can't play games where there's elimination like that. It's just what's the how do you involve them to keep them active? So if it's dodgeball, do you have like a couple of courts you're rotating? And so when you get out on one court, you move to the second court. When you get out that court, you move to the third court, and you're just rotating court so that you have 3 games simultaneously going. So no one is really ever out. You're just moving courts. You can do things like play 3-side soccer. So there's 3 goals in a triangle, and you can have 2 or 3 balls with that. And the kids, generally speaking, the faster kids will gravitate towards the other faster kids and go for a ball that's kind of together. And that leaves the kids who aren't as fast runners to some of the other balls as well. So again, 3-side soccer, 3 goals, 3 small goals. You don't need a goalkeeper for that. And 3 balls on the field, a lot more movement, not as much standing around. You can play with a large number of kids, relatively speaking. You can easily have like 12 kids on the field with that, at least with them moving around for that. Sometimes playing sports that aren't as common in an area also work really well. For example, in the US, we don't do a lot of field hockey, so that's not something that a kid is more likely to be doing outside of school and be good at it. Whereas if you played basketball, for example, there may be kids that are playing basketball in a rec league. That's another way to try and do games as well. And then just come up with the extra rules that you play with them so that they're not out, they're not on it. Basketball's a little harder to do extra balls with it, but there's other ways that you can encourage more activity with the kids that are not as much sport specific skill. Any activity should have intermittent rest opportunities for the children, and they should be allowed to self-regulate intensity and duration. It's especially important for obese children because the cost of locomotion is higher than a small child. A child who is overweight or obese, again, it's going to cost them more to do the activity, and we don't want them to get discouraged. We want them to keep exercising because we know that even if it's not controlling their weight, it's still beneficial for them. And so we want to think of ways that we're not discouraging or excluding kids that are larger than average. And overall, the goal is to limit sedentary behavior for children, reducing the amount of time that they're on the sideline because they got out in that dodgeball right away. For adolescents, we can start moving into more complex games and activities requiring more maturity. Again, you're still going to have a wide range of fitness with kids. I do, again, the kid that has been doing basketball since they were 5 and now they're 15 is going to have a lot more skill than the kid who maybe does sport, soccer. They may be fit, but they have no skill-specific sports for sport-specific skills, for basketball. Children as young as 8 can be successful in a structured resistance training program. So again, we're judging it based on their maturity to hold form, to not scream around the weight room. Most adolescents are mature enough to undertake a resistance training program. It can include free weights, medicine balls, resistance bands. Start doing some weightlifting moves. And as always, it's important to consider maturity and chronological age when determining appropriate exercises. Older adults, this is one of my favorite populations to work with. This is what a lot of my research is helping older adults maintain independence, maintain their skeletal muscle strength and function as they age. How do we do that most effectively? How do we get them to, how do all of us maintain healthy aging? This is one of my favorite topics to talk about. So with older adults, there's anatomical and physiological changes that happen as we age. And it affects pretty much everything: skin, endocrine system, skeletal muscle, digestion, brain, eyes, ears, bones. When I teach special populations on its own, we go over all the physiological changes for each population. And with older adults, it's just like, and their skin changes, and there's muscle changes, and it gets a little gloomy. But with exercise, we can counter a lot of this negative stuff. We can't really help the skin too much, but we can help the muscle underneath the skin. With older adults, we're also worried about polypharmacy. If we're working with a group that is not exercising, may have some chronic conditions, they're more likely then to have polypharmacy, which is multiple medications. Usually, some people say 10 or more. You really don't need 10 to start having these numerous piling on of side effects. It is something to be concerned of with older adults. Our precautions with older adults. Older adults don't regulate body temperature as well. There's a loss of range of motion, a loss of lean mass, a loss of balance. Exercise can help with those last 3 at least. Common barriers for older adults include a fear of injury. They all know somebody who's fallen while doing something normal or while exercising, and they're concerned that they're going to fall and lead to negative outcomes. Lack of knowledge for exercise. This is changing. When I first started working with older adults over 20 years ago, a lot of the women were of a generation where they were told exercise was not good for them. And so they had never really exercised before. They'd never lifted weights before. That's changing. We're starting to get into now people that are hitting the older adult age, 65 or above, where they're at least aware of some exercises that they can do or they have done in the past. Lack of transportation to facilities, more the older adults. Lack of skills, abilities, and confidence. Physical limitations resulting from disease and limited income. So not everybody can join a fancy fitness facility or buy some equipment for their home. Depending on what type of Medicare they're on, they may be eligible for a program called Silver Sneakers, which would give them memberships to certain fitness facilities. That's something to look into if you have some relatives that are looking to exercise and they're on Medicare. I forget it's a certain qualification within that, but that is an option for some. Right. Our older adult exercise prescription for cardiorespiratory fitness training: always do a warm-up. It helps us reduce the risk of a cardiovascular event. Warm and cool down, very important to reduce our risk of cardiovascular events. Super important in older adults. At least 5 minutes of a low intensity activity. 30 to 60 minutes then of the main cardiorespiratory exercise, RPE 5 or 6 on a 0 to 10 point scale, at least 5 days per week, or a high intensity exercise at least 3 times per week. I did a study about 8 years ago, where we had older adults walking on a treadmill, 70% of heart rate reserves. That's vigorous intensity for an hour, 3 days a week. So it can be done, and it can be done safely if you screen the participants carefully. Generally, avoid activities with rapid changes in direction. Agility is low. We don't want to challenge. We want them to improve their balance. We don't want to challenge at the point of a risk of injury. And generally speaking, avoid high impact activities. Now, again, when we do our exercise training plan, it's individualized and specific. If they're out playing tennis and doing high agility activities, we might be able to do some with them as well. But if in general, we avoid high impact activities, avoid activities with rapid changes in direction. Resistance training, at least one set of 10 to 15 reps for 8 to 10 different exercises targeting major muscle groups. Again, I've done resistance training protocols with older adults where we go up to 80 to 85% of 1RM. Obviously, gradually move that up there. But my 85-year-old women have been able to do that. Have not had issues with it. Start with the intensity at moderate or vigorous, and we want to pay extra attention to body alignment in older adults. A lot of time, they may have years of sitting a little funny. There may be some funny. I just mean like a little bit not quite aligned, not on. They may have some back issues or some muscle imbalance that, again, which we saw in somebody who was 25 and they only have 5 years of being off a little bit. They might be aware of it. We have somebody who is 70. They may have 30 years of not sitting optimally and not realize that they're not straight. So we want to pay extra attention to their body alignment. Flexibility of training. Want to stretch the hip, back, shoulders, knees, upper trunk, and neck, so pretty much everything. Hold static stretches at the point of tightness, but not pain. And perform 2 to 4 repetitions per stretch. Generally speaking, when I work with older adults, they like the flexibility training part. They probably like that I do it at the end also, which means they're done. But generally, my older adult participants enjoy the flexibility training more than my younger adults do. Next up on our lifespan exercise is pregnancy. And for someone who is pregnant, this condition is going to affect their hormones, joints, body weight, cardiovascular system, digestion, a whole bunch of stuff. But in most cases, it's safe for the person to continue exercising or even start a new exercise training program. And someone who's pregnant, we're going to be concerned about exercise in the sun, exercise in very hot or very cold conditions. We want to make sure that they're not doing exercises that interrupt blood flow to the fetus. And this is why we generally recommend no exercises on the back after the 5th month of pregnancy. Not everybody is going to have the vasculature where the weight of the fetus is going to push down and impede blood flow to the fetus. But since we don't have a way to effectively screen for that, we just make the broad sweeping no exercise for anybody on their back just in case, just to be safe. Want to make sure there's adequate nutrition to fuel both the growing fetus and the exercise. And then also we need to be aware of an increased likelihood of back pain. On the bottom right here, we have a figure of someone before and after pregnancy. Our spine on the left normally has this curve to it. With pregnancy, these curves become more exaggerated and the gait widens a little bit, which can lead to an increased likelihood of back pains and other issues as well. It's a normal process. It just leads to increased risk of back pain, which we want to be careful about. Benefits of exercise while pregnant include promoting healthy weight gain, improving circulation, reducing discomfort and improving mood, and allegedly eases pregnancy, labor, and delivery. For exercise, someone who's pregnant, at rest, cardiac output, stroke volume, heart rate, and resting O2 uptake increase while vascular resistance decreases. So what this means is that somebody who's pregnant is more likely to experience an episode of hypotension, low blood pressure, with change in body position. This means if you're having somebody rapidly move from sitting to standing or seated to standing exercises, we need to go slowly and be aware that this could cause some lightheadedness, hopefully not fainting, but it could. We just want to be aware of it, make the person aware of it as well. During exercise, heart rate is higher at lower intensities. Heart rate max is also lower when pregnant. And heart rate rest is usually a little bit higher too. So this means that we have a lower working range, right? That range between resting heart rate and heart rate max. There's less there. If the other thing is with exercise, as the pregnancy progresses, the same absolute intensity is going to cause a greater relative intensity response. So, for example, if you have somebody at month 2 of their pregnancy, they're walking a treadmill at 3 miles per hour, their heart rate may be 120, and they're doing this, 5 days a week throughout the pregnancy. But by the time they reach month 8, even though they're fit, even though they've been doing this, now that same exercise is causing a heart rate response of 140 beats per minute. Table 10.1 in your textbook is contraindications for exercise during pregnancy. We have relative contraindications and absolute contraindications. You plan on doing exercise training with people who are pregnant, you should make yourself very familiar with this. Our absolute contraindications are reasons why the person would probably be told not to exercise at all. So, for example, some heart disease, some lung disease, if they have something called an incompetent cervix, usually those people are activity restriction, they're at risk for premature labor, some other conditions as well. Relative contraindications may mean that there may be reasons, these may be reasons that they may stop exercise at some points, but it may be safe for them to return after it resolves. So, for example, a history of extremely sedentary lifestyle. We may need to start that really low and slow. If their diabetes is poorly controlled, we may need to make sure with each session that it's well controlled before they do exercise. And when exercising with someone who is pregnant, we want to check for absolute and relative contraindications. Generally speaking, a woman who is exercising prior to pregnancy has few limitations to start. And it's okay to exercise when become pregnant if there's no contraindications, and okay to exercise. You may still run across this because it's somewhat new, like the past 8 to 10 years, where we used to say if somebody was currently sedentary that they shouldn't start an exercise training program, whereas if somebody was currently exercising, it was okay for them to just continue doing their exercise. But they had an absolute limit of 130 beats per minute on their heart rate, which as the pregnancy progressed meant they were increasing their absolute intensity more and more. So using that walking 3 miles per hour example, the previous slide, by the end of pregnancy, that person may be walking at 2 miles per hour to keep their heart rate 130. We now know 2 things. 1, exercise is generally safe during pregnancy. And 2, that people who are currently exercising, that the benefits of starting exercise while pregnant outweigh any risk that there may be for the pregnant person or the child. So we now recommend exercise just starting, if they're currently sedentary, starting low and slow, of course. The same fit VP is general health. Someone who's pregnant may not want to do vigorous exercise, it may be kind of comfortable for them. But other than that, the 150 minutes per week, so for 5 days a week at least, is the same. For postpartum exercise, generally gradually exercise in the postpartum period may begin 4 to 6 weeks after a normal vaginal delivery. Normal just means no complications, or about 8 to 10 weeks with medical clearance after a C-section delivery. Decondition typically occurs during the initial postpartum period, even if the person was exercising. And women should gradually increase physical activity levels until pre-pregnancy physical fitness levels are achieved. We now say that light to moderate intensity exercise does not interfere with breastfeeding. That's a change also in the past 10 years or so. But speaking of exercise and breastfeeding or chest feeding, about 300 to 500 additional calories are needed for milk production. It's generally recommended not to actively try to lose weight until 4 to 6 weeks postpartum, just to help make sure that the milk supply is established. This current thing, the milk supply is established and it's not going to be interrupted by changes in caloric expenditure like we would see with exercise or active weight loss. Size and soreness of the breasts may limit exercise, especially at the start of this journey. And good breast support is needed. Some women may want extra padding. For my pregnant and postpartum people that I work with, I usually recommend a sports bra with lots of adjustments. One of these examples is SheFit. There's a couple other competitors out there in the market. This was the first one that did this, where not just the straps are adjustable, but also the band is adjustable. So as the person goes through pregnancy and has an increase in chest size and rib cage, it expands a little bit as how tall they are. As the baby pushes up, they can adjust the band size on those without having to buy multiple sizes of sports bras. And then also, making sure the sports bra has adjustable straps as well to adjust. And that also makes it easy if they're breastfeeding or chest feeding, they can easily do that in the sports bra. Exercise prescription specific for pregnancy. Start with 10 minutes a session and work up to 150 minutes per week. Again, if they're already exercising, they continue doing what they're doing. But if they're not, let's start with 10-minute sessions. And focus on core, abdomen, and back for our resistance exercises. We really want to focus on our deep abs, our transverse abdominis, one of our stabilizer muscles. Remember this from chapter 9. And I said we would talk about this more with postpartum. Now's that time. All right. So with our transverse abdominis, actually, let me cover this last point, and then we'll come back to transverse abdominis. And then also the joints in the spine take time to return. So these hormones like relaxin, for example, which help prepare the pelvis for stretching so the baby can come through. It helps relax the joints. That takes a while to leave the system for the effects to leave the system. I usually joke that I used to have really tight IT band. And since I've had my 2 kids, my IT band is fine now. It's still, my second kid is 7. I still have not had a return to IT band issues. And whether or not that's completely from the relaxin, but it was a night and day thing from before my first pregnancy to after my first pregnancy, where it was just like, wow, my IT band is no longer super tight and bothering me. So I guess that's one benefit to the change of it. But anyways, point is, it takes time for the joints and spines to return. It may take 9 months to a year. And so I really want to be careful with positioning for weightlifting, for other exercises, that we're not losing stability with the person. So back to our transverse abdominis. So this is one of our deep abdominal muscles, and if you're not trained it's difficult to activate it without being purposeful about activating it. And the easiest way to do this, if you do this sitting, you can do this lying down. I used to do this pre-pandemic and during my commute when I would hit this one traffic spot on my commute. I'd always do this, and I really need to get back into doing that. I just kind of lost it after not commuting every day for a year to campus. So the way I find the easiest to easiest way to instruct people to do this is we're going to inhale, and then on our exhale, we're going to work on trying to pull our navel, our belly button, as close to our spine as we can. Now, I'm doing this while I'm talking to you. This is not something where it's so strenuous that I can't hold a conversation, that I have to hold my breath or whatever. I can still breathe in and out. I can't really do a deep breath while I'm doing this. No full belly breath, but I can certainly breathe and do this and do abdominal exercises. So I have my transverse abdominis contracted. And while you're doing this, like if you're sitting, you can do this, or you can do it laying. If you hold that contraction, transverse abdominis, and crunch while you have your hand on your abdominal wall. So put your hand on your stomach above your navel, do a crunch, and you'll notice you're pretty stable. You don't have any musculature, really, any subcutaneous fat like popping out while you do that. Now relax for a second. Okay, relax. And now put your hand on your stomach again and do a crunch. And you can feel a little bit more movement, right? There's that little bit, especially if you're lying down. You can really feel if you're lying down. But you can feel some movement of the other abdominal wall of the subcutaneous fat moving with it. So let's do this again. Let's big inhale and exhale. As you exhale, pull your navel, your belly button as close to your spine as you can comfortably get it. Hold and contract that. Now, while you're doing this, you can do your abdominal exercises. You can do crunches. You can do leg lifts. You can do dead bug, whatever it is. And it puts you, in this one nice stabilizing position. So you're reducing your risk of injury. And 2, you're working your strength and your transverse abdominis while you're doing these other activities. So this is a way to get really effective abdominal workouts. And when you first start activating your transverse abdominis, while you're doing, keeping it contracted, while you're doing your ab exercises, you'll notice you fatigue quicker. You release your transverse abdominis. Maybe you can normally do I don't know, I'm just making up names here. Normally you do a 15-second hold on your leg lift, and now you get to like 5 seconds, and you lose your transverse abdominis and end up relaxing. So, but we can train that, and you, just like anything else, you increase endurance of the transverse abdominis, and it helps with stability. For me personally, when I'm doing upper body lifts, especially if I'm standing, I'm making sure that transverse abdominis is contracted while I'm doing my lifting to help keep my posture aligned where it needs to be, to kind of, lack of a better way to phrase it, kind of lock me in to that position, right? And so my core is nice and stable while I'm doing that. So I mentioned this was postpartum, but it's important for everyone, right? And if we have a strong transverse abdominis to start, we're hopefully less likely to injure ourselves. All right, the last thing is I'm going to talk about, just one slide. Found this little figure on ACSM's website. They have a lot of infographics like this, which I find very useful for handouts for people. And it has resistance training for health. So I think we know we're all about resistance training in older adults. And it has some key benefits of resistance exercise, what resistance exercise can help manage in terms of chronic conditions, and some other health benefits. And it has, in this light blue box in the bottom right, what some exercise suggestions would be as far as performing exercise 2-3 times a week, free weights machines and whatnot. So this may be useful for you to use for people you work with.